information. Today we're going to review CPR skills. Some of you may have already taken a CPR class. This will be a great refresher for you. For those of you that haven't learned CPR yet, we will show you compressions and breaths so that when you're able to take a class with us, you'll know what to do. Let's get started. All right, the first thing that you want to remember is to always check the scene to make sure it is safe for you to lend a hand. If the scene is not safe, please call 911 and report what you see. Stay at the scene so that you can provide any assistance needed. Let's get started with checking the victim. If you see someone that appears to be unresponsive, make sure that you tap and shout. If you know their name, yell it out. Art, wake up. If the person is unresponsive, that is a life-threatening emergency. Make sure that 911 has been called and then give care. So what you want to do first is you want to check the victim for signs of life. Are they breathing? Is the chest rising and falling? Do you hear breath sounds? So you're going to look, listen, and feel between 5 and 10 seconds. Tilt the head back, put your ear over their mouth and nose, listen for breathing, feel exhale on your cheek, and see if the chest is rising and falling. Look down the body. 1, 1,000, 2, 1,000, 3, 1,000. If there are no signs of life, they're not breathing, the chest is not rising and falling, and 911 has been called, start CPR. All right, so let's review where our hands go and how we deliver compressions. We're going to deliver 30 compressions and 2 rescue breaths. Make sure that you have your breathing barrier to deliver your breaths. You're going to take one hand in the center of the chest, just above the sternal notch between the nipple line. Goes over the top. Try to pull your fingers up like this so that you don't grab the ribs and fracture ribs. So hold the hand up, bring this hand like this and pull the hand up, and use the heel of your hand with straight arms and straight body to deliver the compressions. Remember, you're not pushing with your arms, you're using your legs and hips. Your arms are straight, and we go 2 inches deep on an adult, at least 2 inches deep. Hard and fast, center of the chest, at a rate of 100 to 120 presses a minute. That is the same as the disco beat. So here we go, center of the chest, hard and fast, straight up and down. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Tilt the head, pinch the nose shut, make sure the mouth is open, and give 2 breaths by sealing your mouth over their mouth. You'll see the chest rise and fall. And each breath you deliver lasts for 1 second. Okay? Repeat that. 5 and 30 and 2, 30 and 2, 30 and 2 until paramedics arrive. Never stop CPR once you start unless the scene becomes unsafe. You're so exhausted that you can no longer continue. Paramedics arrive and tell you to stop, and AED becomes available, and if they show signs of life. Okay? Let's move on to how we would deliver rescue breaths and compressions to a child. So if you have a child, you always want to do the same thing. Make sure the scene is safe. See if the parent or guardian is there. Look, listen, and feel for 5 to 10 seconds for signs of life. 1, 1,000, 2, 1,000. This child is not breathing. The chest is not rising and falling. Real quickly again, ask if mom or dad is here. Make sure 911 has been called. One hand, center of the chest. The other hand, pull the fingers up. Nice straight arms. Use the legs and hips and go about 2 inches deep. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. Tilt the head, pinch the nose, deliver a rescue breath that lasts 1 second long. Re-pinch, re-blow. And resume. 30 compressions and 2 breaths. 30 compressions and 2 breaths until help arrives, a trained responder arrives, you're too exhausted, the scene is unsafe, paramedics arrive and or an AED arrive and is ready to use. Make sure when you're doing your compressions that you don't push down and let the chest go down the appropriate amount and let it rise before you push down again. So down, up, down, up. Don't take your hands off and push like that. Okay, let's move on to how we would help an infant. When performing CPR on an infant, you do need to modify your techniques due to their small body size. So instead of a hand, you're going to use 2 or 3 fingers in the center of the chest between the nipple line. You still want to go hard and fast, straight up and down, about 1.5 inches. Also, as you tilt the head back with your hand on the forehead, your mouth is going to cover their mouth and nose, and you're going to give them a puff of air that lasts for approximately 1 second. So if you fill your cheeks with air and exhale, that will inflate the infant's lungs. So let's go ahead and get started. The same rules apply. Always make sure that it's safe for you. Make sure that you check to see if mom or dad is there and it's okay for you to give assistance to their infant or child, and make the modifications we discussed. Hey baby, wake up. This infant is unresponsive, call 911. We want to tilt the head and look, listen, and feel for breathing for between 5 and 10 seconds. At least 5, no more than 10. The chest is not rising and falling, and I do not feel or hear breath sounds. I'm going to take 3 fingers in the center of the chest between the nipple line and push for 30 compressions at least 1.5 inches deep, or about 1.5 inches deep. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Tilt the head to a neutral position. Take your mouth, cover their mouth and nose, and give 2 puffs of air. Inhale and give them another breath. The chest rose and fell, so I know I got the air in. I would repeat that cycle, 30 compressions and 2 breaths, 30 compressions and 2 breaths until help arrives, an AED arrives, another trained responder or paramedics arrive, or if the scene's unsafe and you need to get out and you're just so exhausted you can no longer do it. So those are our CPR techniques. And then there's one other thing I want to show you regarding compression only CPR. If for any reason you're unable to give breaths or you're not comfortable with giving breaths, you can also help someone by doing compression only CPR. This isn't done in cycles, but it's just continual compressions until help arrives. So everything's the same. You put your hand in the center of the chest for the adult. You can do this on adults, children, and infants, and you just do compression. 1 and 2 and 3 and 4 and 5, 27, 28, 29, 30, 51, 52, 110, 20, 30, 40, and so on. So you just do compressions without cycles until you get the help you need. In closing, always remember a few of these things. Always make sure the scene is safe for you to give assistance before you enter and start checking on the victim. If you have a child or infant, make sure if the parent or guardian is there that you get consent to give care to their child. When performing CPR, make sure that you keep your arms straight and use the strength in your legs and hips to help do compressions. Compressions are done 30 at a rate of 100 a minute. So 1 and 2 and 3 and 4 and 5 and 6. Make sure that you count so that you're breathing, so that you don't lose track of how many compressions you've done. After your 30 compressions, if you are doing breaths, give 2 breaths that last 1 second each. If you're not going to perform breaths and you're going to do continuous CPR, continue with compressions until help arrives, you're too tired, an AED is there, or another trained responder such as myself might come along and identify that I know how to do CPR. And anytime the scene is unsafe, remove yourself and the victim, if possible, into a safe location. Don't forget that Titan Recreation offers CPR, first aid, lifeguarding, and water safety instruction, wilderness first aid, a few times a semester and monthly for CPR and first aid. Check our schedule when we get back on campus. We'd love to see you in one of our classes. Have a great day, take care of yourself, and be safe.